Dear Dr. Vadan, it's very nice to have you here today. Could you please tell us a few words about yourself, your role in your country's delegation, and what is your background and focus in your practice?
Well, I am a neurologist. I work in Cluj-Napoca in Romania. Neurotrauma actually has always been one of my main focuses in research, and I am here today to see what we can improve in our country, what other countries are doing that we can also start doing in our country. And I would also like to present to other countries and to other delegates PRESENT Registry, the international registry for trauma that we want to introduce, and the Academy for Multidisciplinary Neurotraumatology is actually helping us in implementing it.
What motivated you to get involved in neurotrauma research?
Actually, I've been involved in neurotrauma research from the beginning of my residency. When I first started, I was a volunteer for one of our institutions, for a neuro institution in Cluj-Napoca, and there was in our clinic also a trial that was also going on. I think everyone knows the Captain trials, and I was a volunteer in that trial also, and it also focused on traumatic brain injury and the treatment that could be applied to patients in order to improve the outcome.
I see. Thank you very much. Are you satisfied with the management of neurotrauma in your country?
It's a good question. I think no one is ever satisfied with the management of any neurological disease in their country. I think we doctors always find ways that could be improved and things that could be done better. And I think each and every country does the best it can with the resources it has, and the fact that we are all here today proves that we are trying to improve every year and each time to get better and better at what we are doing.
I see. Do you have any suggestions regarding the improvement?
For my country, especially because this is the best I know, the best things that I know, I think the first step forward would be having a national TBI registry. And this is what I think we are trying to do by implementing the PRESENT registry in our country, to have a database that we could use, that we could see how the patients are improving, and to have a statistic that we could use in order to improve even more the treatment that we are applying.
That sounds very interesting. Could you share or describe an example of good practice for neurotrauma management in your institution, something that you think would be appropriate to be implemented in other institutions as well?
So I think in our hospital, whenever there's a traumatic brain injury that comes to the emergency department, it's always the neurosurgeon is called, the neurologist is called, and we take a decision together to see which would be the best course of treatment for the patient. And I think this multidisciplinarity is actually a good thing that happens in our hospital.
Good point. Could you please highlight for us the main challenges in the treatment and research of neurotrauma in your country, or specifically in your institution, if that is the case?
I think that in our hospital especially, keeping in mind that in Cluj usually we have different clinics with different specialties in the hospital, in the city, that are dispersed. And actually I think this one is one of our main challenges, the fact that the patient has to go from clinic to clinic in order to get the treatment it needs. And I think this is something that rehabilitation clinic, and usually the rehabilitation part in patients, I think it could be improved quite well, and I think it should be more focused on the rehabilitation. And this is, I think, one of the main challenges in our hospital, the rehabilitation part. We're having kinetotherapists that are in our neurology clinic, for example. We have our own kinetotherapy team, but I think it would need a better rehabilitation ward that could be used for our patients.
Okay, you've made some very interesting points. Could you please describe in 2 or 3 sentences some innovative approaches that you believe could bring a substantial change in the treatment of neurotrauma?
It's a very good question, thank you. And I think from what I've seen in the research that is done nowadays, I think a great thing would be to implement the biomarkers for the diagnosis and the prognosis of a traumatic brain injury, and I think that would be a great plus. And especially, as I said before, the rehabilitation part, if it would be more focused on and it would be a larger ward that would be used, I think that would help the patients even more.
What I want to ask you next is your opinion about an international TBI registry and the way do you believe it could impact the management of TBI?
I think this is a great question that you are asking, and the fact that we have the PRESENT Registry that we are trying to implement and that we are using for a few weeks now, I think months actually, now it shows how much we believe in an international registry that could be used for everyone in order to see how different countries approach TBI and what is the difference, and these differences could be used to help improve the management and treatment and diagnosis of TBI in each and every country. So yes, we are supporting 100% an international registry, and we hope that it would be used as soon as possible in every country, at least in Europe.
Thank you. What is your opinion on the most important quality indicators in neurotrauma care?
This is a complex question actually, and I think, in my opinion, I think the best quality indicator would be the lack of complications after a traumatic brain injury. So the fact that the treatment was good enough, that the patient has no disability at the end of the treatment, the patient is fine and it can continue its social life and its daily activities without any disability and without any complications from the traumatic brain injury. I think it's the best quality indicator nowadays.
Thank you. A multidisciplinary team is a vital asset in TBI management. From your point of view, what specialists should a multidisciplinary team of TBI include, and why do you believe so?
Yes, I support 100% the fact that multidisciplinarity is a must in the treatment of traumatic brain injury. And I think from what we've seen in the treatment of TBI, it should always be made, and it should always have a neurosurgeon, a neurologist, and ICU staff present, and also rehabilitation staff present, because rehabilitation it's a very important part from the treatment. So from the emergency department doctors to rehabilitation specialists, I think they're all needed and should communicate together in order to have the best outcome for the patient that we are treating.
All right. What are the main obstacles in terms of collaboration in a multidisciplinary team from your point of view?
Well, I think the main obstacle it's the lack of time, and it's the number of patients that each specialist has to see. There are many emergencies happening each day, and each doctor has to see different patients and different cases. So it's a problem to have enough time and to have the best period to communicate with other specialties, so that everyone can communicate together in order to see the patient and to make a decision about the traumatic brain injury patient. So I think this is the most problematic thing, the lack of time for each specialty. But we are trying. I think it's in that each country, and I think each doctor is trying the best it can to have the time necessary to discuss with colleagues and to make a specific decision and the best decision for the patient, of course.
Thank you. Could you please identify some of the strongest points and some of the weakest points in the research of neurotrauma in the present days?
Well, that is a very complex question, and from what I've seen and from what I've read, I think it's a great thing that research nowadays focuses a lot, I think, on biomarkers and the way that they can help the diagnosis, the treatment, and the prognosis of a traumatic brain injury. And I hope it will be used very soon in all countries and in all clinics. They will be used. And the rehabilitation part, actually, I think many studies nowadays focus on the rehabilitation of the patient with a traumatic brain injury in order to obtain the best outcome for the patient and in order for the patient to resume its daily activities and its social life as soon as possible. And I think these are the strongest points. And the disadvantage, I think, that I see in the research today, I think the fact that it's very hard for each country to implement them, and it will be a great effort from every country in order to be able to implement and to use them to the best of their possibilities.
This is indeed a very interesting point that you've made. How do you feel an online community for those interested in neurotrauma could impact research, and do you think it would also be helpful in medical practice?
I think the IMN also already shows that an international community, it's a great thing, and it helps in the research. I think we've all seen from the congresses and from the meetings and from the fact that we are all here today that the discussion that were made and that will be made will help usually each and every country to improve their treatment, to improve the way they are seeing patients, traumatic brain injury patients. So I think every meeting, every international meeting actually helps, and each and every one of us learns a little bit more and goes back home with a few ideas that he or she will implement. I'm sure about it.
Thank you. Actually, the next question I wanted to ask is in regards to the IMN. So I've seen that you are familiar with the organization, and have you ever participated in any of the IMN congresses as a speaker?
Yes, actually, just a few days ago, the last IMN Congress ended, and I was a speaker there, and it was an honor to be able to participate as a speaker. I've always followed the IMN Congresses, even from residency, and it was always a pleasure and always something for me to learn about and something to be able to implement and to be able to use in the treatment diagnosis of my patients.
That is great to hear. What is the impact that you believe that COVID-19 had over the neurotrauma management in your country or regarding the caseload?
I don't think it's a specific thing just for Romania. I think COVID affected every country in the world, and I think it affected every traumatic brain injury actually in the treatment of each and every one of them. Because, as we know, COVID is a very important problem. The patients were unable, all of them, to get to the emergency department, or they were afraid. And not every traumatic brain injury patient came to the emergency department in order to be seen and to be evaluated. So I think this one is one of the most important problems. And the fact that we had to wait in order to do the imagistic part for every patient, every CT scan had to have a longer period of time in order to have it sterilized after each patient. And I think there was a delay in the treatment and diagnosis for patients, and I think this was a very important thing that affected the treatment and the prognosis of patients.
Right, and for my last question, I wanted to ask, what do you consider to be the main challenges in the prevention of neurotrauma?
Well, we all know that prevention of neurotrauma is a thing that nowadays each and every country has to work with and has to been trying to improve it for the last years. In the youngsters, we know that the main cause for traumatic brain injury are the road traffic accidents, and I think this is one of the most important part where we have to work and to be able to explain to the young people and to the young drivers the importance of safe driving, of keeping distance, of driving slowly, and to be always attentive, because I think this is the most important way to prevent more traumatic brain injuries. I think because we've seen that road traffic accidents are one of the most important cause for TBI.
All right, thank you very much. This will
Thank
be
you.
the end of our interviews, and I appreciate very much your answers to our question, and we hope to keep in touch.
I'm sure we will.